Assalamualaikum and hi. My name is Nazatul Ashikin. Now, I would like to present my topic today, the use of pharmacoepidemiology to study beneficial drug effects. First, we need to know the definition. The definition of pharmacoepidemiology is the study of interactions between drugs and human populations. For a drug, there are 4 types of drug effects that we should know. First, unanticipated harmful effects, that is, the unwanted effects of drugs that could not have been predicted. Second, the anticipated harmful effects, that is, the unwanted effects of drugs that could have been predicted. Third, the unanticipated beneficial effects, that is, the desirable effects of drugs that were not anticipated at the time during the marketing. Last, the anticipated beneficial effects, that is, the desirable effects that are known to be caused by the drugs. There are 2 terms that need to be understood here. First, drug efficacy, that is, the ability of a drug to give intended effect. Second, drug effectiveness, that is, the capability of producing a desired result in real-world situation. Clinical problems by pharmacoepidemiologic research. During the pre-marketing drug trial, they usually shows high efficacy due to atypical clinical settings, bias in selection of participants with similar age group, with no underlying disease and no other drug interactions. However, in the post-marketing practice, that is in the real world, there are variations in drug regimen, characteristics of the indication for the drug, and characteristics of the patient receiving the drug, including socio-demographic factors, nutritional factors, and presence of underlying illness. Thus, the objective of this study to reveal considerable gaps in the information about beneficial drug effects at the time of during marketing. Methodologic problem by pharmacoepidemiologic research, that is, confounding factor. Confounding factor is a variable other than the risk factor and outcome variable under study which is relatedly independent, thereby can create an apparent association or mask a real effect. We do not always need randomized clinical trials to study beneficial drug effects. So, what are the available solutions? Here are possible research questions that are classified according to their problems of confounding by the indications therapy. First, there is a situation that don't need analytic research for their answer. The situation is either the drug effect is obvious in the individual patient or the drug effect is obvious in a series of patients. Second, some questions about beneficial drug effects can be answered using formal non-experimental studies because there is no confounding by the indication. For example, in primary prevention, that is vaccination of measles, that can be routinely administered to healthy infants. Third problem is the confounding factor exists but controllable. When the indication can be measured sufficiently well, then traditional epidemiologic techniques of exclusion, matching, stratification, and mathematical modeling can be applied. Last problem is when the confounding by the indication cannot be controlled. Non-experimental study designs cannot then be used, or they can only be used to demonstrate qualitatively some degree of beneficial effects. In the future, non-experimental study or observational research have been recognized by clinicians for long. However, due to limitation of the study, some scientists insisted for randomized clinical trial as the only scientifically reliable method for assessment of the drug efficacy. However, when an experimental study is deemed to be unnecessary, unethical, infeasible, or too costly relative to the expected knowledge to be gained, there might be a reasonable alternatives. Thank you.